The former managing director of Life Esidimeni, Dr. Mkhatshwa, is testifying in the Life Esidimeni Inquest. He says the deaths of 144 people were beyond his control. The inquest is investigating whether anyone should be held criminally liable. Reporter Manqoba Mchunu, and focusing on that story today, has been tracking the proceedings. Good afternoon, Manqoba, joining us now here. Again, the spotlight today being thrust on the state of the patients when they left Life Esidimeni. It came under the spotlight again, so to speak, during the inquest.
Well, certainly, Pretend, you've recalled that there have been several claims that have been made by some of the NGOs where some of the patients died during this particular marathon project. And of course, some of those claims include the fact that some of the patients were in a bad state when they left Life Esidimeni, and the fact that when they arrived at these NGOs, some of them didn't have the proper clothing. There were items of clothing that were missing, and also that in terms of the medical records, they didn't arrive with their medical records. So those are some of the claims that we've heard from some of the NGOs, and as well as the former director of mental health here in Gauteng, Dr. Manqoba Mchunu, through her lawyers, who also insist that during the quarterly meetings that they'll have, there used to be complaints about the poor conditions in which some of the patients were in, that some of them were found in a dirty state at Life Esidimeni. And so this was really in the spotlight at the testimony that was given over the past few days. And of course, Life Esidimeni sticking to its guns, but then insisting that those allegations are not true and that the patients at all times were maintained in a proper way. And of course, this is quite relevant, but then because you recall that the report of the Health Ombudsman in 2016 had found that the patients had died from dehydration and starvation when they were moved to these illegal NGOs. But Life Esidimeni is saying that they were not to blame. In fact, they're insisting that when the patients left their facilities, they were in a good condition. But take a listen to how that argument unfolded in court.
Are you satisfied that the patient's personal care in respect of clothing, footwear, and personal requirements such as toiletries were properly met?
The needs of the mental health care users were properly met, and I was quite comfortable with that. Thank you, my lady.
Doctor, did you from time to time yourself visit the facilities to satisfy yourself that there was compliance with the service level agreement?
Yes, my lady. My team, the head office team, would go and visit the facilities and do our inspections and comment on whatever we thought needed to be improved in the facilities on an ongoing basis.
And were you satisfied that the patients that you saw, the users, my apology, the users were properly clothed, that they were clean, and were you satisfied with their general appearance and health?
I was satisfied. There would be one or two cases where you find somebody who is who needs constant changing, and they would explain at the facility that that particular user needs constant changing and that they attended to it.